Remember that kid who wouldn't look at you, wouldn't talk to you, sat by himself? That was my son. I'm Jennifer Cato, and I'd like to educate you on Asperger's syndrome and how it affects those who have it. Obviously, I'm passionate about this because my son, who is 17, was recently diagnosed. And I've seen the devastation that is caused when people don't understand the issue and have understanding and compassion. I'll discuss with you how Asperger's is diagnosed and how it is treated, and the nonverbal communication issues and everyday interaction issues that those with Asperger's have. Keep in mind that people with Asperger's have average intelligence, and they know when they're not fitting in, and that knowledge leads to more desperate situations. You can use this understanding when you interact with somebody with Asperger's, and be kind and understanding. Asperger's is becoming more and more common. You may have even met somebody with Asperger's and not even known it. According to the Center of Disease Control Center, the CDC, 2015, 1 in 68 are affected. Males are more common. The cause isn't known, and diagnosis isn't easy as a blood test. They use IQ, behavioral questions, interaction, and you can be diagnosed early. However, many won't be, not until much later in life. Although there is no cure, there is treatment, such as cognitive behavioral therapy, educational, and support programs that can help them adjust and become more comfortable in their surroundings. This is a spectrum disorder, and the symptoms and the severity will fluctuate. Nonverbal communication, however, is a very common struggle. It is customary to look in somebody's eyes, to use those nonverbal cues to complete the picture of what's being said and their emotions. Tigla emphasizes in a 2015 article in Children's Health about Asperger's syndrome that they lack those skills and they miss a lot of those messages. 65% of our communication is nonverbal. Eye contact is uncomfortable and difficult for them to make, and they typically will look around or at the ground, which is what my son does. They often misinterpret or not respond to things like pointing or the look that you'll get from your mother when you've done something wrong. Using facial expressions of movement, they don't come naturally to them, and they're typically unsuccessful. They may not even try to use them. But that's not the only thing that makes communication difficult or awkward. Daily conversations are typically dynamic and interactive. They may not be when you're speaking with somebody with Asperger's syndrome. You may notice they speak in a monotone voice or very formally, or they don't engage at all. According to a well-known organization, Autism Speaks. When they do participate, it's one-sided, and they only talk about themselves or their interests, which are very limited and intense, such as video games, which is what my son currently is interested in. Not being able to communicate like everyone else can lead to much more serious issues. When children, adolescents, and adults feel left out, they can become depressed, develop anxiety or low self-esteem. Social anxiety is something many people with Asperger's syndrome experience because they isolate themselves because they can't interact as everyone else does. And speaking with Dr. Hageman of psychiatrist at Meridale Achievement Center on November 20th, 2015. He conveyed depression is likely in people with Asperger's if they're not treated, because they long for the relationships they see everyone else have, and they don't know how to get them. Many times they're treated differently, or possibly bullied or ridiculed, which could result in self-esteem, low self-esteem. As you can see, knowing more about Asperger's syndrome can give you insight as to why these classmates sit alone, or why your coworker prefers to email you, or why that child just doesn't look you in the eye when he's talking to you. When you notice someone's straining with nonverbal communication or everyday interactions, they may be a sign of Asperger's syndrome. If you're in a position, discuss it with their physician. Maybe they need to be diagnosed and treated. If not, remember how you interact with them can have positive and negative effects. My son has Asperger's syndrome. He wasn't diagnosed early. Regardless of my repeated concerns, I didn't know the signs. He was bullied and left out and lonely. He is currently in a long-term treatment facility for suicidal thoughts, depression, and anxiety. This is important. I hope that you have gained some insight into Asperger's syndrome so that you can help with awareness and help with early detection.